Virginia, George, Dick, and Marjorie all lead happy, active lives in their retirement years. Few would suspect that they all battle a common disease, a disease called clinical depression. Today, there are more than 260 million people in America. And according to the U.S. Department of Health and Human Services, nearly 18 million people suffer from depression. Sadly, only 1/3 seeks help, partially because they may not recognize they have depression.
Depression means different things to different people. There's depression with a little d and depression with a capital D. And most people are familiar with the little d type of depression, which is you feel a little bad on a given day, you've had some problems at work or an argument with someone at home, and you kind of feel down, and you may be down for a matter of minutes, sometimes for hours, but you pull yourself out of it. It's the sort of thing we all go through from time to time. Depression with a capital D is something very different. It is a clinical disorder. It is a mental disorder. And it's a situation where the person is depressed all the time, and they can't pull out of it. No one can talk them out of it. If something good happens, it doesn't bring them out of it. They're depressed 24 hours a day, 7 days a week.
Statistics show that women are more than twice as likely to have depression than men.
We really believe hormonally women are more vulnerable, particularly during times of like after a pregnancy or while they're on birth control pills, sometimes during menopausal states. All of these things can be factors.
Depression can be a result of many things, including our childhood environment, trauma, injuries, personal losses such as divorce, loss of a loved one, or loss of a job. But it can also be passed down genetically.
Sometimes it can arise spontaneously, and that can be very confusing to people because they wonder, why am I depressed? And we now believe, and we have very good evidence, that indeed it is an illness like high blood pressure, like arthritis, like diabetes, except it's an illness that affects the brain.
Clinical depression is brought on when certain chemicals in the brain called neurotransmitters become unbalanced. This disturbance in the brain's chemistry creates the symptoms often associated with depression: feelings of anxiety and insecurity, sleep disturbances, unexplained periods of crying, decreased energy and fatigue, feelings of hopelessness, feelings of guilt, sadness, irritability, chronic aches and pains that don't respond to treatment, loss of interest in hobbies or work, a loss of concentration.
What we look for is a cluster of those signs and symptoms. Having a sleep problem alone doesn't make a clinical depression. Overeating alone doesn't make a clinical depression. You have to have the loss of interest, the loss of mood, plus a number of those other symptoms to make the diagnosis of major depression.
In older adults, depression is often missed because the symptoms are sometimes seen as changes due to aging or are hidden by other medical conditions.
A lot of the patients that we have, particularly the elderly, have a lot of medical illness in addition to their depression. And in some cases, their reaction, their psychological reaction to having the medical illnesses is part of the reason why they have gotten depressed.
The important distinction is that aging in and of itself probably does not contribute that much to differentiating depression in a 55-year-old from a 75-year-old. However, the fact that a 75-year-old is much more likely to be physically ill or to have Alzheimer's disease or to have some other complicating problem in his or her life, then that's what makes the depression in late life somewhat more difficult to identify on occasion and to treat.
It is important to understand that depression is not a normal part of growing older. Depression can affect anyone at any time, regardless of age. Looking back on her life, Virginia now realizes that she had actually experienced symptoms of depression as a child, despite being raised in a happy and loving home.
I can remember when I was 4 or 5 years old, sitting and thinking, oh God, this is awful, and I'd have this weight on my chest, and I'd cry and stuff.
Virginia faced her feelings alone, often hiding out in her room until the sad feelings passed. She managed her illness that way for over 37 years, while balancing the demands of a husband, 2 kids, and a busy career. But by her mid-40s, something started to change.
I just all of a sudden just couldn't face things, and so up there I was to the point where I wasn't working like I should, you know. I just couldn't seem to get up and go. I thought there was something wrong with me mentally. And and of course I wasn't living close to my children. They were both married and gone, and I felt I wasn't being a good mother or a good grandmother, and I just felt I wanted to end it. I just didn't want to keep on. So that's when I knew I had to have help.
Fortunately, Virginia's doctor recognized the symptoms of clinical depression and placed her on an antidepressant. Treatment for depression often includes a combination of medication and counseling. Antidepressants can help restore the brain's chemical balance, but they take time to work.
They're not pick-me-up pills. They're not pills that make somebody feel good. And lots of times there's misunderstanding about that. Someone may take an antidepressant and think, well, I should feel good within half an hour of taking that. That's not the case. What antidepressant medication does is treat the disease depression, and over time, several weeks, it will, in many cases, completely reverse the depressive illness.
Clinical depression comes in episodes, much like a person might have an occasional flare-up of arthritis. Some people get only one episode. Most people, like Virginia, have more. However, medication can't be taken only when symptoms develop.
You can't take antidepressants, for example, on an as-needed basis. You know, today I feel down, I'm going to go ahead and take it, and then skip it for a week or two and try it again. If you really have a consistent period of depression, you need to be patient and stick with this drug much like you would, you know, insulin or a blood pressure medicine or thyroid medicine, any long-term kind of condition, until you and your doctor agree that it's time to stop.
For Virginia, medication helped her regain control and resume her active life. Though she still experiences episodes of depression, her medication and knowledge about her illness continue to help her recover.
I know how to handle it, and I go with it, and I work my way out of it. And so, but you have to make up your mind. It's up to you. You can't sit around and feel sorry for yourself. You really can't.
One thing that we frequently try to do with the older person who's depressed is to get that older person in one way or another to be involved in some type of social setting. If you can find something where that person can even maybe be around other people, that can go a long way toward breaking that cycle of isolation.
The way I work out my depression is doing something for somebody else. And I think, well, gee, if I can do somebody some good, that makes me feel good too. And I think it's good for my depression. You look so pretty. Thank you.
Now, when Virginia begins to feel an episode of depression come on, she takes a walk or reads a book or visits with a friend. And there's also time with Pete, her cockatiel, a present from her kids.
Okay. I think half of depression is to admit you got it. I really do. And work towards it.
At 67, George has also learned how to manage his depression. He experienced his first episode 7 years ago when he and his wife Louise were living in New York. At that time, George was working in construction.
I had 8 years to go to my retirement, and I was very fortunate and felt very good about having that job.
One night while working the overnight shift, George was mistaken for a trespasser by security guards.
I told them that I worked there, but they didn't seem to get it then, and they just acted like a bunch of thugs. First, I was knocked down to the ground. I was kicked in my ribs. I was stepped on. It was traumatic.
After verifying his identification, the attackers eventually released George to get medical help. Bruised and battered, with torn ligaments and a fractured rib, George soon discovered that the beating would take both a physical and mental toll on him, changing his life forever.
I not only lost the job, I lost all my insurance because you have to be an active participant to receive this insurance.
Facing unrelenting physical pain and growing financial pressures, George began to sink into a deep depression.
I couldn't provide for my wife. That was my main concern. I was worried about my wife's welfare and her feelings towards me because of this and because of it. I actually became helpless and useless.
In an effort to put the past behind them, George and Louise moved to North Carolina to join their daughter. But the change in location did very little to help pull George out of his depression.
He stayed in the bed all day. And that wasn't like George. George is very active, he's very energetic. So I knew something was wrong. And then George talking about, oh, well, the death talk. Oh, I might as well give it up. You know, I might as well be dead. I said, what do you mean you might as well be dead? Well, I'm no good. I can't do this for you. I can't do that.
As his thoughts of suicide grew stronger, George knew he had to have help. He consulted a psychiatrist who placed him on an antidepressant and arranged for him to have regular counseling sessions, but his progress was slow. Anxious to find some relief, both George and Louise enrolled in an exercise and nutrition study at a local university. The study was to determine if monitored exercise, combined with proper nutrition, could help people with their depression.
We are learning more and more about the importance of moderate exercise in older persons for a variety of reasons: quality of life, better sleep, improving function from osteoarthritis, and the same is true for depression. Certainly, moderate exercise it can be beneficial to older persons with depression.
With the help of the study, George now manages his depression with regular exercise and healthy eating habits. Today, he's off of his antidepressant and feeling great.
I can't say enough about that exercise program. It really starts your day. It starts your day and you just go through the whole day with a different attitude altogether. If I feel kind of bad, I'll come down here and I'll jump on the bike down here and I do something and I exert myself and it goes away.
Since the exercise program, he's more energetic, he's easier to get along with. He doesn't complain as much as he used to about his situation, especially his financial situation. It seems as though he's learning to accept it. This is what it is, this is it.
I have returned to myself again to be outgoing and to go and to accept my situation as it is and don't let it bother me. I don't let it bother me.
At the age of 71, Dick has been through numerous bouts of serious depression, years of medication, and countless treatments. Dick was 20 years old and in the Air Force when his first bout of depression hit. 5 decades later, he still remembers the experience as extremely frightening.
I felt sort of unattached or disjointed from people. Didn't feel or that I was making the normal connection. Conversation would go normally, but I didn't feel as I normally would. I had real difficulty in sleeping, and I found little pleasure in the things that I normally would have.
Dick waited until he was discharged before telling anyone about his feelings. At home, his family doctor ordered a series of tests at the local VA hospital.
and there they determined that it was depression. I was there only a few days because there literally was nothing that they could do for you at that time. At least there was no medication.
Eventually, Dick learned that both his mother and grandmother experienced many episodes of clinical depression. It was clear that he had inherited the same tendencies. For many years, Dick found himself managing his episodes of depression by staying busy. But by the 1960s, the pressures of a new job and the stress of relocating his family to a new city triggered a severe depression.
He was not sleeping and he was agitated, and finally it got to the point where he just really needed help.
For the first time since his diagnosis, Dick was placed on an antidepressant. The medication helped him sleep, and eventually that gave him the strength he needed to regain his life. But at 49, Dick would face yet another major episode of depression when he lost his job. This time, he was hospitalized for 30 days, placed on a new antidepressant, and given electroconvulsive therapy, or ECT.
There's a lot of stigma to ECT, which in some settings is called shock therapy. It's important to realize that this is a treatment just like any other treatment. Sometimes it works, sometimes it doesn't work. Every treatment has side effects, and every treatment has potential benefits. ECT for many patients is a safe, effective, and rapidly acting treatment.
It's really a relatively painless and actually quite safe treatment in which an electric current is actually passed through the brain. It induces a seizure. The seizure generally lasts somewhere around 25 seconds. And then probably 2 minutes later, the muscle relaxant wears off, the seizure is over, the older person wakes up, and usually the only side effect the older person will have is maybe a little memory difficulty and some headache.
For Dick, the combination of ECT treatments, medication, and counseling helped him gain control of his depression. Today, 28 years later, he continues to take medication and remain under the watchful eye of his doctor. So far, he's had no major reoccurrence of the severe symptoms that once plagued him.
I've accepted the fact now that most likely I will need medication for the rest of my life. There are still times when I have some slight problem, but I know in my heart and in my mind that it will pass, and it does, and therefore it's not nearly as disturbing as it once was.
Looking back, Marjorie now realizes that she actually experienced her first bout of depression in her childhood.
I was born in England right after World War I, and I lived in Lancashire, which is the county on the northwest coast. It's the place where cotton used to be king. My dad was worked in a steel mill, and he made machinery for weaving the cotton. Unfortunately, he died when I was 6 years old. So my mum moved us to the seaside where my grandparents lived and bought a boarding house, which was a hard life. That's where I grew up, helping in the boarding house, waiting tables, changing beds. It's hard on a little kid. I very seldom had a bedroom to call my own, especially in the summer, because Mother used to rent out all the bedrooms. So I've slept on the dining room floor many a time.
Miserable, Marjorie often experienced crying spells and periods of sadness. But these periods disappeared once she left home to serve in the occupation forces in Vienna, Austria. While in Vienna, she met an American GI who would steal her heart.
Bill was a very, very sweet nature. He was a people person, very amiable. I never knew anybody that didn't like Bill. He was just a lovely man.
The two married in 1948 and set up home in the U.S., eventually adopting a son, Jeffrey. For many years, Marjorie remained free of the sadness she had once experienced. But all that changed one Christmas when Bill became seriously ill.
My first depression came when he had 2 heart attacks for Christmas, 1969. My mother, 80-year-old mother, was living with me, and that wasn't easy. I had a very difficult job at Duke. Jeffrey was about 11, and he was having a lot of problems in school, and I just fell apart.
Marjorie spent 6 weeks in the hospital, where she was treated with medication and had regular sessions with a counselor.
I don't think I'd be here today if it wasn't for therapy. To be able to tell the doctor about things that I thought were not very admirable in me, and it's awfully difficult to get it out, was a relief. And have somebody listen to me, and it just was, it was a lifesaver for me.
Over time, the medication and counseling sessions played a major part in helping Marjorie get through Bill's bouts of illness and eventual death. But years later, she would become severely depressed once again when she moved into a retirement community.
And I was very, very lonely, and I used to lay in bed at night thinking, what have I done? Sold so much of my lovely stuff and given up. I thought I'd given up my independence. I was very, very miserable. All the same things were affected, you know, like sleep. It's the terrible, heavy sadness that you feel, and that feeling that nobody's there for you, you know. That's the hard part about depression.
Fortunately, Marjorie's therapist recognized she needed additional help and had her admitted to a hospital. There, she was able to begin her road to recovery.
You think you're going to be down there forever, and you really do when you're in a clinical depression. You think, I'll never climb out of this mess, but you do come out of it.
It's a big box.
Today, with the help of medication and regular counseling sessions, Marjorie continues to successfully manage her depression. And she's also discovered a new passion.
I love the computer. That has done more to help my depression than anything. I got friends all over the internet, and I find things like International Trivia Quiz, and go all over the web and everything. If I get blue or down, I go down there and play the International Quiz. And I win sometimes, too. Yeah, it's fun. It really is. It's made a big difference in my life.
Indeed, Marjorie is now engaged to Lyle, whom she first met on the internet. She has learned, as have Dick, George, and Virginia, that even with depression, you can have a happy, satisfying, and rewarding life.
Depression is very treatable, and that's very important for the individual who's suffering from depression to understand, as it is for the family members. They may not understand that they may pull out of it, but that they will, if they are treated effectively.
First thing I will tell an older person is that you need to recognize that you've got a problem, and you need to get the outside help that you may need to try to deal with that problem.
You don't have to stay in those pits forever. It's rough climbing out of them, but you can do it.
But you have to make up your mind. It's up to you. You can't expect other people to do it for you. You really can't.
Go get the help. It's there. It can be dealt with effectively, and it won't last forever.
I don't know if it's curable, but I know you can get a handle on it, and I got one.